It's another exciting episode of the Medley Show coming to you from the studios of NTA Entertainment here at the nation's capital, Abuja. My name is Cecil Egbele. Now today, we will be talking about the care for our bones. Okay, yes, you might tell me that your bones are very good. I don't know, when I was doing geography, how many bones did they say we have? Over 200 or something, and I'm wondering how. Okay, anyhow, but how do you care for your bones will be the focus of our discourse today. There are many things we do that actually have a long-term effect on our bones, like we've discussed previously on this program, sitting posture. How do you sit when you're on the computer? Maybe some of you who have these very expensive, luxurious chairs in your homes without proper backrest. So these are many other issues with what we'll be talking about today on the program. And of course, for many of you have, I know in Lagos, they have this orthopedic hospital called Igbobi, yeah, where you see, and many other states will have theirs. And they specialize in treating bone problems. All right, you may think that this is not important for you, but trust me, you just want to hear what we'll be talking about on the Medley Show today. All right, let's go straight in, and I have a guest with me in the studio. He's an orthopedic surgeon with many years of experience. Hopefully, he'll tell us about it as we continue to discuss. He is Dr. Anthony Amadu. So Anthony Amadu, welcome to the program.
Thank you.
All right, you're a consultant at the Alliance Hospital?
Yes.
All right, thank you very much, doctor, for coming on the program. I was very poor at biology, truth. How many bones did they say we have then?
226.
26?
226.
226 bones. I mean, come on now. I just don't think one will have up to 226 bones in this very small body.
Yes. So somehow that's the number of bones. When you put together all the bones in the extremities.
Okay, that's true. There are the small
bones in the ribs, in the vertebrae, put together it's up to 226.
Okay, good. And then, very often you go into the theater, perform surgeries on people's bones and all that stuff. Are bones problem really that bad? I mean, do we get frequent cases of such? I know it's not like malaria where we get to have that every day and people just get healed from it. So how bad are bone problems?
Bone problems, particularly bone pains, low back pains.
Lower back pains,
yes, is one of the commonest presentations, one of the commonest causes of pain in people older than 40 and above. And even in the younger adolescents, let me not put the very young, the adolescents also come with back pains.
Back pains, what causes that?
Okay, now, you want to start talking about the causes, we want to classify the causes. The causes could be mechanical or non-mechanical or organic in origin. When I say mechanical now, I mean causes due to structures around the back. Structures around the back could be the spine, which is the bone that holds us up.
Show me where the spine is. So that's that center one there.
Yeah, the spine starts from the neck.
From the neck.
Down to the tailbone.
Okay.
It now depends on the level. On the neck, we call it cervical spine. On the chest, around the chest region, we call it thoracic spine. As we move lower down, get to the lumbar spine, and then the sacral spine, and then the coccyx.
As much as possible, speak normal English that we can hear, but it's okay. Continue.
Okay, now. Okay, as much as possible, I'll be.
Yes, speak regular ABCD English. Okay.
Now, so the pain can arise from any of this region of the back. Okay, now the causes, as I said, could be mechanical. When I mean mechanical, I mean structures around the bone itself. Could be the bone itself, could be the problems, or the muscles around the bones, could be ligament attaching one bone to the other. Then it could be the spine. The spinal cord also runs just beneath the bone.
Spinal cord runs beneath the bones.
Okay, I don't want to use the medical word now. It's just run in front of the bone. Let me put it that way.
Okay. Anyhow, but I think we should just go straight up into one major bone or maybe joint problem that might be a little frequent, maybe past people age. Arthritis?
Arthritis, okay.
Yes, arthritis. Does it have to do with weight? I don't know. Educate us very quickly.
Okay, now, when I say osteoarthritis, in layman language, that is degenerative or wearing off of a joint. Let me put it that way.
Okay.
A joint is wearing off, and then it's now coming with pain and inflammation. It is called osteoarthritis.
Okay, sorry. Let's come simpler. And I can be part of this conversation by reaching us via text messages or WhatsApp on our phone line. Ask your questions on bones, whatever bone challenge or problems you are facing, or you know someone who is facing. Ask us those questions on our phone line 081 177 82020. That's our phone line 081 177 82020. What bone challenge are you having, if any? Then do ask us a question. He's just talked about arthritis, but to have a clearer picture of arthritis visually, let's take a look at this feature put together by Mercy Ricketts. It's on arthritis. All right, so let's see that.
Arthritis, osteoporosis, and fractures are some of the common problems that people face as they advance in age. These bone-related issues, if ignored, overlooked, and left untreated, can span to become severe and may hinder mobility. Even though some of these bone and joint-related issues can be said to be a natural thing with old people, a lot can be done to prevent orthopedic problems while you age. Orthopedic problems don't simply appear. They slowly develop over time, and because of this, it's common for them to start appearing as people age. Learning about these problems and the things that can compound issues can prevent serious injury down the road. So let's take a look at ways you can prevent orthopedic problems as you age. Maintain a healthy weight. Obesity puts more weight on your joints, which can weaken muscles, hereby increasing the likelihood of injuries. Every time you gain excess weight, there's an increased risk of developing osteoarthritis. Eat right and make your meals balanced and healthy. Exercise. Routine physical exercise is important for our overall health. Staying active through physical exercise is important for the maintenance of the health of our bones and joints. It helps boost flexibility and keep the joints supple. Exercise improves body balance, strengthens muscles, and reduces clumsiness. Walking, swimming, yoga, stretching, biking are great for the bones. Avoid exercises that can put too much stress on your joints, like deep knee bends. No matter your age, keep walking to increase muscle mass. And always warm up before and after exercising. Build your core muscles. If your core muscles are weak, you can be easily prone to injuries from overuse or even simple activities like bending and lifting. Strong core muscles help you balance your body weight. Adopt healthy habits. Sit in a good posture, straighten your spine, and pull the shoulder back. Carry lighter weight on your shoulder to prevent stressing the shoulder and back. Use supportive pillows when you sleep, and also sleep in a posture that goes with a human being's natural covering of the spine. Go for checkups regularly. Regular visits to your doctor is a great way to stay on top of your orthopedic health. Orthopedic problems aren't like other health challenges. Very few are the result of genetics, but mostly actions that you take every day. The things you do or don't do are what puts you at risk. Taking action now is the best way to deal with these conditions. Prevention is often more effective than treatment.
All right, thank you very much, Mercy. Indeed, prevention is far more effective than treatment. Doctor, you've seen that feature.
Yes.
You want to add something to it?
Yes, the video is very comprehensive. Actually, the aim here is to teach you on how to maintain a healthy bone. And you can, particularly when you are getting older, and you can actually achieve this when you are younger.
Okay.
When you are younger, let me quickly give a statistic. Between 15 age 15 and 25. That is when we attain what we call maximum body mass in bone mineral density.
Bone mineral density.
Yes. So whatever you can do to acquire as much as possible bone mineral density between this age, the better for you. Because from age 25 in the female, the bone begin to degenerate or lose its bone minerals faster, from particularly in females when they get to menopause.
Oh,
the hormones
begin naturally.
Naturally, when you get to attain menopause in the female, for instance, the hormones that helps to prevent degeneration of bone, which is the estrogen, is cut off. So bone now degenerates faster than the more it degenerates, because normally every cycle bone degenerates and then newer one is formed. But when that hormone that prevents degeneration is no longer there, it degenerates uncontrolled, and the rate at which it's formed is much slower. So you lose the bone mineral density, and such bone is prone to weakness and easy to fracture. Okay. In the male, from 70 and above, that's
still natural.
Yes, still naturally they lose more bone minerals. So in essence, whatever you gain between this active age of yours, which is what this video is trying to portray, that eat good food, exercise as much as possible, and then attain good bone mineral density, so that when it's losing, you won't lose as fast as those. Whatever you gain during the rainy day is what you lose when time comes.
Yeah, but I would like to know, what are some of our daily habits? What are some of the things we do daily? Like, ladies want to slay, so we wear high heels. So later, you guys tell us that it has one effect on our legs and our toes and all that.
Yes.
I mean, is that really?
Yes. Yes. High heels has its side effect, to be sincere. When you wear a high heel,
okay,
the normal anatomical axis is lost. You tend to, your lower, or that's the lumbar region, tend to protrude forward a little bit, increasing that C shape on the back.
Okay.
Yes, that is where number one it starts from. Assuming you are wearing a high heel, I will ask you to demonstrate.
Okay.
When you stand, you don't stand straight the way you normally stand. Yes, this tilts forward that the heel has caused you. Then there will be stress on your back, so the chances of developing low back pain is high. And now, because the mechanical axis is also distorted, it transfers such distortion to the hip, to the knee, to the ankle. So the chances, particularly if you wear for a long period of time, the chances of developing low back pain, hip pain, knee pain, ankle pain.
Is this something that that develops comes over time?
Yes, over repeated use, not a singular use.
Yeah, for instance, but when one goes older, 40, a little over 40, 50, you have to start stepping down your use of the heels. Right?
Yes, but preferably, and if you must use heels, because actually it makes a lady more elegant. But if you must use heels, you don't use for too long, maybe an hour or so. So if you are going out, you have a supportive shoes that you can use as supplement.
All right, let's take a question now. Hello, NTA. I'm Abdul from Abuja. I saw a doctor at Garki Hospital, Abuja, a couple of weeks back, and while I was having back pain, I did a scan. I was diagnosed with having 7 holes in my spine, and I'm just 48 years old. Please, doctor, what's your advice?
Holes?
7 holes.
I don't understand.
I don't understand too. 7 holes in the spine?
7 holes.
Well, it didn't tell us if he had an accident before or if there was...
They may need to investigate further. They need to do a CT scan. Okay, and take more detailed history, like if it was involved in an accident that led to fractures. But holes just generating in the back is very rare. That is one. Then two, even in those people that have very bone quality, it is not holes we see. Rather, we see compression fractures.
Okay, another one says, okay, you didn't write your name. Doctor, I want to know why I always have cramps in my leg and my hands, mostly at the joint. And there is also this thing that I used to feel on my hand or leg when it comes. I can be sitting or standing. I will not feel my hands or legs, and I will find it difficult to move the leg or my hand.
Okay, now, if the nerve that supply the hand, the leg, they all travel from the brain through the back you know, through the vertebrae I was telling you, they have passage through that place. So if for any reason these nerves are compressed, it can give these symptoms. So you may have to go investigate, are the nerves really compressed? This can be done through MRI. If it's compressed, at what level is it compressed? And if the compress is severe, it can be decompressed. If it's not severe enough, the exercises the video is trying to portray sometimes help in the decompression of such nerves.
Okay. Thank you very much for that explanation. Now, talk to us about some of the our sleeping posture, for instance. Does it have any? Yeah, you know, I know you remember it's got to do with our spine. You talked about the spine just now.
Yes.
Yes. So how can I properly sleep so that I won't wake up and be having pains in my neck or in my back?
Yes. Most importantly, the kind of mattress you're going to sleep on is the key to having a good night rest. If you sleep on mattress that depresses when you wake up, like assume the shape of your body when you wake up, when you stand up from such mattress, I think you stay away from such mattress. You want mattress that when you stand up from bed, it remain flat, remain the way it were before you lay on it. So such that your body does not assume an abnormal position when you are sleeping. So some mattresses are designed to be that firm and keep your natural body when you are sleeping. That is number one. Then two, some believe when you lie on your side, you should flex one of your leg. If you're lying on the left, for instance, the left leg should remain straight, while the right one should be flexed at about 90 degrees. It helps in keeping the normal, we call it load. You should not use the normal curvature of the back intact. Yes, but basically that is. But most importantly is the kind of mattress you're lying on.
Okay, so the kind of mattress you lie on is very important.
Determines the shape.
Okay, okay. Now, sometimes over the years, we get to see some people who slouch as they walk. Yeah, so I don't know if it's it's kind of posture, maybe something they've been used to from growing up, but somehow they are not up straight. What could be the problem?
Okay, yeah, the spine, that's a spine pathology. Now, spine pathology can arise from low bone quality, can be genetic in origin, and can be due to low bone, quality or low bone quantity. Let me put it that way. When I say quality down, the bone mineral density that I mentioned earlier. When I say quantity now, the amount of calcium present in the bone can be less. So in children, and this is very common in children with low calcium in the bone, a situation or due to low vitamin D, a situation called rickets. They may grow with the spine either bending one way or the other or forward, as the case may be. And then in the older people with osteoporosis, as they grow older and the bone quality is now less, they may have what they call compression fracture, and they may come with. And that other condition that is not really related to the quality or quantity of the bone, like scoliosis, it has nothing to do with the quality or quantity, it has to do with genetic problem. They come with back bent to one side or the other. And the other conditions, Guillermo's disease, that I don't have, if I mention, they won't understand.
Okay, yes, we will understand. Okay, good afternoon, my beloved presenter and honorable doctor. Sir, which are the organisms responsible for arthritis? These symptoms, do they come from bone marrow or tissue?
Organisms?
Yeah, so which are the organisms responsible for arthritis?
It's not an effective process.
Okay.
Arthritis is not it's a degenerative process. That is, the cartilage, the shock absorber of the joint that covers the bones, is wearing off.
On knees, right?
All the joint has
arthritis. You know, just
it can be on the shoulder, it can be on the elbow, can be even this little two fingers.
Hello, I've always thought arthritis because you're overweight. Maybe your weight is too heavy for your legs, so your legs.
Not strictly that.
Seriously?
No, yes, it can be any of the joints can undergo arthritic changes. Now, arthritis can be primary arthritis due to as we grow older, and it could be secondary arthritis due to other conditions like inflammatory condition like rheumatoid arthritis, infective condition like tuberculosis. They can all lead to one form of arthritis or the other.
All right, so we are learning so much. Please keep your questions coming, and our phone lines once again is 081 177 82020, showing on your screen. All right, Shola, where are you writing from? It says, Some people are observed to be shorter in height as they grow older. What is responsible? Does that have to do with bones?
Yes, sometimes has to do with bone. So when there's osteoporosis, as I said, the backbone, the vertebral bone, they undergo fractures, and then the height of the bone get to compress. So you have to investigate to be sure it's osteoporosis, and then you treat appropriately.
My name is Chinedum Daniel. I had an accident on the 6th of this month. After 2 different x-rays, there was no dislocation or fracture found. Congratulations to you. You're lucky. I trust you're doing good now. Okay, who is this? Doctor, I'm data hygienist for Port Harcourt. I was coming down with bow legs. What's that?
How old is he?
You know, he's not telling us that. He just wrote he's coming down with bow legs.
With bow legs, okay. Bow legs could be due to arthritis again.
Oh, really?
Particularly if a long-standing arthritis eventually leads to bow leg. Bow leg could be due to low bone quality too. Like if there's that's why I say how old is he? In adult we call it osteomalacia. A lack of vitamin D, lack of calcium in the bone due to the deficiency of vitamin D in the body. The bone now become weak and begin to deform. Other conditions like Paget's disease of the bone can also lead to deformity.
Is that treatable? Is that
For all of these conditions can be corrected. Once we investigate, is it due to calcium deficiency, due to vitamin D deficiency, is it due to Paget's disease? Now, depending on the level, whatever level it is, once there is deformity and you've treated the primary cause, you can now go do surgery to correct the deformity.
All right, doctor, I will talk about something that is quite different from what you do, but it still have to do with bones. Would agree with me, you're a Nigerian, or you're an African.
Yes.
We realize that many people patronize the traditional bone setters. Yeah, so they are, some people say they have some success rate, but there are some minuses about what they do that we may talk about later. But just very quickly, let's have a look at this feature. This feature took a look at the activities of some of these traditional bone setters. We have them in different communities. In fact, doctor, there are some people who will tell you that they first went to English hospital, then after many you are smiling because you know people have told you that,
exactly,
right?
Exactly.
Yeah, some other persons say that they would prefer to get treated with an orthopedic surgeon because they have all the machines to check into the bones. While the traditional bone setters, the way they do this thing without anyhow, but you want to make say something about them before we get to take this.
You see, what differentiates the orthodox from the traditional is one, we put into consideration alignment.
Yeah.
We put into consideration the soft tissue. Now, if you fracture a chicken's leg, for instance, a leg of a chicken or animal, and you keep it like you keep it like that, it will unite, but how well aligned is the union? That's the problem here. Fine, the bone is united, but with deformity, as against the orthodox that opens, put it in the right correct alignment, and then fix. If you keep that bone like that, eventually the man will walk. That's the truth. But if you're working with a limb, work with deformity. And once the mechanical axis of the bone is distorted, it has a back effect on the joint above, even joint below, and the entire body. So primarily the fracture was on the leg. Later you come with hip problem, you come with back problem.
Yeah, that's true. Yeah. That's very true.
So that is the truth.
Okay, so let's take a look at that feature put together by one of our correspondents, Ben, on these traditional bone setters.
There are between 206 to 213 bones in an adult and 300 bones in a child's body. The bones make up the skeleton, which gives the human body its shape. When one of these bones are broken through accidents of different origins, the individual is immediately taken to the hospital for the orthodox orthopedic doctor for treatment. But we also have the traditional bone setters. Nigerians have different preferences. While some prefer the orthodox doctor, others prefer the traditional bone setters. We caught up with Usaini at his place of work and asked him which is actually better.
By principle, I cannot discriminate as which type of bone settings is better. As a bone setter myself, if a patient is brought to me and I evaluate their case, and if I can handle it, I will ask questions pertaining the circumstances that led to the injury. Afterwards, I will know what to do. If it is something that needs hospital attention, I will tell you truthfully to go to the hospital. If it is something that does not need hospital attention, then I will do it. I will tell you that you just have to believe in your heart that my treatments will work without any doubt. This incident is destined from God. Therefore, He will heal you.
With testimonies of how many bone setter cases have had to go to the hospital for proper treatment, is there actually something wrong they are doing, or is it something else?
That is true. For bone settings, you have to be patient. There are rules and regulations. When a patient comes for bone settings, there are rules he must follow and make sure he adheres to the rules and regulations. If I set your bone in your house, I have to come and check on you every 2 days. And if you go against the rules I have set for you, I will know, because this is where the problems occur. But if you follow the rules as a patient, then you won't have a problem.
If you do once, when I see, I will know. Irin haka ake samun matsala. Amma duk wanda aka bashi ka'ida aka ce ga abinda zaka yi, kar kai kaza, kar kai kaza.
But if there should be a problem, then I will check. And if it is something I can rectify, then I will. But if I cannot, I will recommend you to go to the hospital.
To zan iya ce ma yes, zan yi. In ko ba zan yi ba, ba zai yi ba, to zan gaya ma gaskiya. Ka je asibiti.
Before we left, we asked him how long he had been in the business of setting bones.
Dori na gargajiya na gade shi from my father. My father shi ma ya gaje shi from him father.
Setting bones I learned from my father, who learned from his father, who learned from his father. And if I die now, my son will take over.
It's my son.
The traditional bone setters have been with us for a long time and will continue to be with us. As long as there are broken bones, there will always be a traditional bone setter.
Well, these traditional bone setters are in many cultures, many states. You get to find them. I am wondering, it's seeming to be hereditary. Like, you go to school to study this, but the children, they are, I guess, is a trade. It's passed on from generation to generation. Then something else he also said, when he tries and he cannot do it, then it sends to you. You get cases like that?
Yeah, sure. I have plenty of cases like that. The truth is, there are a few orthopedic emergencies, among which is open fractures. Open fractures, no matter how little the injury over a fracture is, please don't take it lightly. It's going to hurt you later if you take it lightly. So open fractures, I'm sure the man knows that you don't delve into that. You need to be taken as an emergency, treat the wound as if something else is involved. Otherwise, the bone will heal, but you keep managing chronic osteomyelitis, the bacteria will be there, refusing to go. That is one. Then two, if you want that video clearly, all it does is to splint the leg, put it in one position. And that's why he said he'll come back to check. If you move the stone or whatever he used to wedge, you will know something has gone wrong. So he wants the leg to remain in one position and allow nature to take its place. Now, the splinting, is it like this? Is it like this? That is the difference now. One, in the orthopedic setting, in the orthodox setting, we open, get to the bone, because we know the knowledge of anatomy. We know how to run away from vessels that can be compromised. The one thing the presenter has failed to quickly add is the complication that comes with, you can see those splints. Sometimes, particularly when the sun takes over from him, he must have learned over time not to apply too much pressure when applying the splint. When the sun takes over from him, he may not understand that nitty-gritty, apply splint, particularly in young babies. you see come with gangrene. Horrible. All because of, sometimes there are no fractures. So that splint he applied must be applied diligently and give respect to the blood vessels to that region. That's the major difference. We know how the vessels travels and how to avoid troubles. But they don't. They need to go to school.
They need to go to learn that. Okay, well, whether he's traditional doctor or he's native doctor or orthodox doctor. Okay. Okay, now that person that sent the bow-legged story, I'm having pains at my knees for more than 10 years now, though not severely. I went to the hospital and my doctor said it's natural.
Me?
Yes, it's natural. That I was coming down with bow legs. Okay, that's the bow leg story because it wasn't complete. Well,
we need to investigate.
Yes.
Why the bone is suddenly turning bow.
Yeah, everything we give you here, it's you have to actually have to see a doctor to actually confirm the exact situation that you might be facing. Yes. Good afternoon. Please, I want to know the causes of upper pains or pains of the upper and lower thighs of the leg and what the condition is called.
Pain on the upper and lower
thighs. You said just the thighs.
The thigh is on the lower limb.
Yes.
Then the upper limb now. Again.
Maybe just mean thighs. I don't know.
Okay. If it's just the thigh, you need to ask more questions. Is there a low back pain? Because pain on the back can actually radiate to the thigh. Oh. Yes. And then is there an injury? How long has the pain been there? Is there associated swelling? Does it, the pain is severe to prevent him from sleeping, or just a dull aching pain? You understand? We must get to the root. We cannot tell you the cause of pain on the thigh just by, you telling us that. I mean.
Okay.
You must
see a doctor.
You must, yes, ask more questions about it.
Hi, doctor. I've been having this pain in my waist for over a year, mostly when I stand for too long. Haven't been taking. You call the drug diclofenac.
Diclofenac, okay.
Yeah, drug. Yeah, say I've been having the pain since then, but each time I stop. I don't know what that means, but say he's been having that pain.
Yeah, each time he stops, the pain record. Yes, the truth is you must first, again, know the cause of the pain. Is it a mechanical pain, as I said, or pain coming from a distance? When I mean distance now, other structures in the abdomen, if it's a female, the uterine pain can refer to the back. Ovarian pain can go to the back. In the male, prostatic issues can go to the back. So we must really get to the root of the matter. Then, however, you will need proper evaluation to know the cause of the pain and then to be advised appropriately how to take care of his back. If it could just be a mechanical pain because of the posture, how he sits, how he lie, and then he will need some physiotherapy. But we must get to the root of the problem.
Adeyemo Iretiayo. I have pains in my hips and I was diagnosed with osteoarthritis. Yes, and I don't want surgery. Please, what can I do? And I'm just 36 years old.
Again, osteoarthritis does not depend on the stage at which this condition is. If it's a severe type where the acetabulum, that is the cup holding the hip bone or the thigh bone, is adhered to each other.
Yeah.
That's like the highest stage of the condition. He cannot escape surgery.
Escape.
However, if it's the early stage, physiotherapy, intermittent analgesia, exercises may help to reduce the rate of progression. So again, he needs to be evaluated and know what stage of osteoarthritis we are dealing with. All
right, let me take two questions, then we'll go on to take a vox pop. Good afternoon, sir and ma. Please, what is the cause of numbness between my knee and foot joints? Sammy from Uyo. Then the second question from someone else is, Doctor, I normally feel pain in my right knee because I have boil on the right leg. All right, let's take the guy who is feeling numbness in his knee and his joints.
Yes, most times, a good percentage of people, such numbness may be coming from the lower back. The nerve that supplies the knee, it could be trapped at the back, and it comes with numbness and sometimes paresthesia, that is tingling sensations along the leg. So you need to be evaluated again.
Please. This person is talking about I feel pain in my right knee because I have boil. I think he has a boil on the right leg and he feels pains on the knee.
Okay, yes. The boil, how long has the boil been there? Boil is usually due to bacterial infection. If the same bacteria found its way into the knee, it can lead to the osteoarthritis I was telling you about. Secondary osteoarthritis due to infection. So again, you may need to be seen. You may need antibiotics to take care of it.
Okay, so can I take a question or two before we take the Vox Pop? Okay, I guess I'll just quickly take this. Hello, doctor and the host. Nice work you people are doing there. I am Olga Thomas. I want to, please, doctor, I have been having pain behind the kneecap to the extent that the pain is going up to my thigh. I don't know. This is a little confusing. Please send your question again and in simpler terms.
And with age, sometimes age, the kind of pain, cause of pain in the elderly may be different from cause of pain in a 10-year, 15-year, 20-year-old.
Okay, the person is afraid of. You talked about. I don't want to call it rheumatism because whenever I want to stand, I hear sound like a stretch to the vein. Okay.
Okay, here's some cracky sounds.
Is that a cracky sound?
At the back, on the hip, where?
I don't. I hear the sound like a stretch to the vein.
Okay. Okay.
Maybe that's not clear enough.
Well, it can occur. Maybe the muscles are trying to stretching out while standing from a position. So most times, exercise is all he needs. Routine muscle strengthening exercise is all such an individual needs. So when you allow your muscle to be too weak without activities, it can be responsible.
Okay. All right. Thank you very much for keeping your questions coming in. I would like to take as much as I can. But meanwhile, I went on the street. I sought to know from many of you. Our crew went on the street and we asked you the question, if you have a bone problem, who would you go to? An orthopedic doctor or a traditional bone setter?
I would rather choose the orthopedist instead of the bone setter. My reason is that I'm not going to say that our traditional ways or the bone setters are not good or are not reliable. But the modern days we find ourselves now that is more safer and more convenient compared to what we face in our traditional way of setting the bones.
Our forefathers introduced a means of treating bones before the invention of these orthopedic doctors. So the means they are treating is far more better. I've seen people who went to even orthopedic doctors, they came back with the same issue. And when they go to traditional healers, they got healed. So I think our traditional healers are very good in treating bone issues.
An orthopedic is a certified doctor that has a certificate and knows what he's doing. I'm not saying the traditional doctors don't know what they're doing, but then I prefer somebody that actually studied what they are doing for a particular period of time.
A traditional native treater. Because first of all, I know and I've seen or I've heard about when you go to a traditional pedic doctor, it's easier to heal quick. The bones comes. When you go to orthopedic, I realize that they keep going to the hospital to meet the orthopedic once a time, as in once in a while. They will have to go and check on their bones.
Definitely I'll consult an orthopedic because one, as a professional practicing doctor, they have access to better equipment to make proper analysis of what the situation is. And on top of that, they've carried out in-depth study about that field compared to a native doctor that has limited resources and old knowledge on what needs to be done.
Orthopedic, of course, because they are the specialists of bone setters.
I will visit an orthopedic as a first aider because when you go to the place, they will make sure they put you well first. But at the end of it, you must have to go back to a traditional bone setter.
Why?
Because I believe that they set it very well. And some of the orthopedics doctor or whatever we call them sometimes, they only just put the, what do I call it, POP.
Doctor, that guy say you're a first aider. So you're just a first aider, right? And you just put POP on our legs and our hands.
We see this a lot. They will come for resuscitation. They will first, as they are admitted, you must have invited the traditional bone setter who will sneak in, come with agbada. Honestly, he will come, look at the patient, say no problem. When they finish the station, bring him. But they will come back. we know they will eventually come back, but they come back with complications.
I know.
And they want you to do magic. You know, they come back with complications, either shortening, bowing, infection.
Okay.
These are the complications that comes with traditional.
Wait, seriously? The traditional bone attendant will sneak in just to see.
I tell you, you sneak in, they will get the X-ray, look at it. Say, when you finish, drink in. So we will now resuscitate, because they know resuscitation is key to survival. Because it's not about the bone alone. Patient must be alive to have a good bone. So when you finish resuscitation, they will say they want to go, and they will discharge against medical advice.
Okay.
Yes, that is one. Then two, there was something he said that I wanted to add to what I
okay, when you remember later.
When I remember, yes.
All right. Good afternoon, my wonderful my wonderful president and doctor. Can you please give us examples of food which are rich in calcium? Chris from Abeokuta.
Okay, you see, sometimes you don't even need to take calcium supplements. We have abundant calcium in the bone, but for some reason or the other, this calcium may not be absorbed because of deficiency of vitamin D, which is very important for calcium. So we rather ask you to take food rich in vitamin D. And once you get enough vitamin D, this calcium will be mobilized back into your bone. Yeah, because excess calcium in the body can be detrimental, can cause kidney stone, can cause, it has been known to cause prostatic cancer, for instance, and all this.
Okay.
Yes, so we try to avoid. However, bone is rich in calcium. So expose yourself to sunlight.
Sunlight.
Yes, it's a good source of vitamin D. Eat food like milk, egg, liver, or cod liver oil. They are rich in vitamin D. Once you have vitamin D, calcium will mobilize from the intestine, and then you have enough calcium in your bone.
Good day, doctor. I'm Chinyere. I've been having pains in my joints at the age of 25 until 40 years. I was diagnosed negative to
rheumatoid.
What do you call it?
Rheumatoid factor.
Exactly, arthritis. What's the cause?
Okay, he's now 40.
Yeah, he's 40, but the diagnosis was negative to that. But he's still having pains in the joint.
Which joint now?
He's still having pains in the joint. Okay, maybe...
All the joint, hip joint.
Okay, please send your question again so we'll be clear what joint you're talking about. Good afternoon. I've been having waist pain. Please, what can I do? Waist pain is still the lower back pain, maybe?
Yes, it has the lower back pain. One of the commonest causes of clinic visits. Yes, good. If you have 10 adults coming to your clinic, 7 of them will come with low back pain, orthopedic clinic. Yes, that's the truth. And then the cause might just be just the way you position yourself or the way you lie on bed. And then we advise you appropriately. However, we still need to investigate to be sure there's nothing sinister happening away from the back, sending pain to your back.
Okay, hello. Sir, hello, ma'am. My name is Nancy. My neighbor has a leg longer than the other. Recently, it was discovered that the liquid, I don't know if it's a tendon or the ligament at the waist of the leg that is long, is worn out. Yes. She don't have money to go for surgery. She wants to know if there's a kind of food that can help her replace what's worn out or something to do.
That is the 4th stage of osteoarthritis I was telling you about. So the head of the thigh bone has collapsed, and it is now shorter than the other. You know, the head can give about 2 centimeters of the length of the bone. So when it collapses, the other leg that is still intact will be longer than this other one.
Wow.
Now, as per the treatments, I'm afraid there's no amount of food or supplement that can regenerate that head back. We have to replace the head with an artificial head called total hip replacement.
All right. Hello, my name is Igwe Chika. I have pain all over the joints in my body, and there is swollen on my hands and foot. I have been to many hospitals, and they have given me drugs, and some work and some don't. After the drugs, the pains come back, and now I'm having serious heart pain, unable to breathe properly. What can I do? Very complicated.
No, not really. I think you need, again, it is swelling around the joint or the entire hand, and it sounds more like rheumatoid kind of arthritis to me, considering the fact that there is associated swelling around the joint, and the fact that he's beginning to have some cardiac manifestation. Let him go for proper evaluation. So they need to take his or her blood sample, do x-rays to look at the joints, and then do X-rays of the heart, ECG, and all those kind of things. So it's not something you can prescribe over the. You need to be evaluated properly.
Glory from Calabar. I cannot squat normally, especially on the toilets where you need to squat.
Is it the hip? Is it the knee? Why can't you squat?
Why can't you squat?
Again, we need to squatting starts from the hip joint down to the knee joint. So one of them will be involved, and then you need to know why.
Okay, doctor, what can be done to prevent this in the life of an underage 20 to 25 years suffering from a severe joint pains on both knees and waist? Do I understand this question? He wants to know. He has joint on knees and waist. I want to know how to prevent it for those under the age of. If you have it already, how do you want to prevent it?
Okay, yes, having pain around the
waist and for someone between the age of 25 to 30.
Okay.
Well, that's not clear enough. I'd like to send that
again.
again.
A lot of things can maybe be responsible, to be sincere with you.
Okay, what type of drug can one use if feeling back pain? Can we use agbo?
Agbo? I'm sure you must have tried agbo.
You must have tried agbo.
And this so-called agbo, to be look at it critically, it actually contains some anti-inflammatory agent, but at what dose? And if you keep depending on these drugs, they may affect your kidneys. Yes.
So what's the natural?
Even in orthodox medicine, we need to be careful how you give those drugs because of the mechanism of action that can affect the kidney. So if you keep having low back pain, you must know why you're having low back pain, and not just depend on drugs. Sometimes just exercise. Sometimes physiotherapy is all you need, and you begin to enjoy yourself. Yes, but being a sedentary lifestyle, not exercising every day, is better.
Okay, now let me ask you this question. We're Africans and everything. Our mothers come to do omugo. Then they want to, when they're taking care of the baby, apart from, they turn the baby like this, they'll twist the baby like this, they'll twist the baby like this. And then the mother will start screaming, it's okay. She said, no, it's good for the bones, doctor.
No, I don't see how that would be good for the bone. Well, maybe they want to make the joints flexible.
Okay, because they'll tell you that
they do that a lot, and the pediatricians, they actually frown at it. Well, I'm sure they usually escape because these children's ligaments are still very pliable and not as stiff as my own here. So those things they do is not to, it doesn't make the bone stronger in any way, but rather it works on it may help in stretching the ligament. These things that we are advocating for people to do every day, yoga exercises, is what the grandma is doing.
Oh, that is it. Yes. Okay. That's yoga at infantry. Okay. All right. Who is this person now? This person says, I have a niece. Okay, let's see. I have a niece and she is premature, but she's now 4 years old, but she can't walk. But when you hold her to move, she stands on her tiptoe and can't put her foot flat to the ground.
Prematurity could be a predisposing factor to what we call cerebral palsy, which is most likely what is happening to this baby. One, she up to now, she still can't walk, and when you now try to make her walk, she walk on her toe. It has to do with insult to the developing brain. Developing before the brain develops properly, one insult, or there may be infection, or even the prematurity is a very big risk factor for cerebral palsy. So he will need to be seen in hospital, and physiotherapy and other therapies will need to be given to the child.
Okay, there are still many questions coming in, and I appreciate it, but I would really like you not to call so that I can take as many messages as possible. But doctor, just before we go, you heard of the passing away of music legend Sir Victor Waifo at 80. Why he is fan?
Yes, if I remember, if you see Mommy Water,
never. I actually interviewed him, and he told me he actually saw Mommy Water.
Oh, seriously?
Yes, he said he was young, he was in Lagos, he just went to relax at the bar beach in Lagos. So whenever there's gone about 1-2 a.m., he just wanted to get some inspiration for his song. Then a mermaid, a female figure came out of the water. And he saw that the female figure has a fish tail. Then he went he was like shocked. Then the figure told him, Guitar Boy. Then when he called him Guitar Boy, he was shocked and he went back again like, he said, Guitar Boy, that you don't be afraid. When you see Mami Water, you should not be afraid and everything. He said he never told anybody that and anything. After over some years, he decided to make a song out of it. So when he said Guitar Boy, and he stringed that, that string is like his shock when he saw the Mami Water. So that thing was actually, says it was actually...
So it's a true life.
Yeah, it says a true life story. When you go to his house, he has a place underneath his building where he calls the Revelation Tourist Center. He has sculptural pieces of so many things. Anyhow, and he was actually a lecturer at the University of Benin. Okay. So just to make a quick tribute, we actually... Well, two students of Mass Communication Department, University of Benin, Farida and Juliet, they actually talked with some lecturers at the university, two lecturers at the university, who told us about the man, Sir Victor Waifo, from the academic point of view. So let's quickly have a look at it, and then we'll come back to conclude.
Victor Efosa Waifo and I were classmates during my undergraduate days here, and later on he came back for his master's, and then I was teaching as a lecturer here already, and after his master's he came back also for his PhD. He was a very resilient individual. It's a global phenomenon. If I recall vividly, that song, Jerome, was made when he was just 25. And by implication, it meant he thought years ahead of himself.
As you were coming into this campus, as if the T-junction there, you see a sculptural piece. I think that was what he did at the undergraduate level. But when you look at that work, it has gone through many years, but it's like something that was done not so long ago.
If you see Mami Water. Specifically, he was an artist of class and repute. He's in the area of music, instrument, improvisation, design, and production. He wasn't just an artist, a scientist, an engineer. He's a capsule of some sort, capsule of different parts. Whatever he believes in, his PhD project, his PhD work was specifically tilted towards imitation. The ivories of Benin, they've gone extinct, but he wanted a way of representing ivories, and that's what his PhD thesis was all about. He made some chemical compositions, reinvented ivories, even if they were chemically compounded, but they gave an impression of ivories. He uses the ivories and the thoughts anymore. At least he left with a chemical option of reproducing an imitation of these ivories. And it is there, it will be there forever to learn from.
All right, thank you very much to Farida and Juliet for conducting that interview. And that's the man from the academic point of view, Sir Victor Waifo. I would like you to sing a line or two from his work, though. Can you sing anything?
Guitar boy.
Mami Water, never you run away. Hey, hey, sing a song of sweet melody. All right, so someone actually sent this, Professor Sir Victor Waifo of blessed memory, was a cultural icon of inestimable value, a natural treasure, an ocean of knowledge in matters relating to culture, particularly of the Benin Kingdom. He documented the history of Benin with its artistic works, performing and virtual things. This is coming from Barrister Roxin Igelige. All right, thank you very much for that. So, Doctor, let's take a few messages before we get to round up this. Okay, let me just take this one. Please, in the case of military men, they stay longer even after they retire from service and they don't have such problems. Well, I don't know what the person is trying to say. Is it true?
No, they do have. They won't go announcing it. You see a lot of them coming, particularly low back pain. You know, they stand a lot.
Yeah.
One of the predisposing factors is long standing and all that. So they have issues too.
All right, Dr. Amadou Anthony, orthopedic surgeon, and I want to thank you very much for coming around and doing justice to the topic. We will try to take care of our bones, even though if we already have some of these problems, I don't think we should go and start doing some strenuous exercises, even though you say exercises is good.
This is key, yes. Exercises is key to strong bones.
All right.
Yes, it's my pleasure being here.
Thank you very much. And that's the size of Medley show for this day. Thank you very much for being part of this picture. Let's do this again next week.